on COVID-19 Recovery and Neighborhood Investment Committee. Today is Tuesday, August 24th. Madam Clerk, can you please call the roll?
Yes, Madam Chair. Council Member Martinez.
Present.
Council Member Harris-Dawson. Council Member Price.
Here.
Thank you, sir. Council Member Cedillo. Council Member O'Farrell.
Present.
Back to Council Member Harris-Dawson. He's absent. And back to Council Member Cedillo. Absent. We have a total of 3 members, Madam Chair, and a quorum.
Okay, thank you, Madam Clerk. Mr. City Attorney, can you explain our speaking rules so we can go ahead and take public comment before we discuss any items on today's agenda?
Sure. So let me just read in the call information very fast. So if you're calling in, you dial 669-254-5252 and use meeting ID number 161-855-4858. Again, that's 669-254-5252 and use meeting ID number 161-855-4858. Then you press pound, and then you press pound again when prompted for participant ID, excuse me. Then press *9 to request to speak. If you're doing it on the internet, please raise your virtual hand. And as the speaking rules go, this is a special meeting so there is no general public comment. You have up to 2 minutes to speak for the agenda items. Please let us know which items you want to speak on, and please remain on topic. If you're off topic, you'll get one brief warning from me or the president. At that point, if you don't get clearly on topic or you stray off topic again, you will forfeit the rest of your speaking time and we'll move on to the next person. And importantly, if you are on the phone and listening on another device, please turn down the volume on the other devices. Between feedback and a time delay, it causes a lot of confusion if you continue to listen on the other device. And with that, Madam President, we are ready to take public comment.
Okay, let's go ahead and take the first caller.
Please state your name and the items you'd like to speak on.
My name is Estella Suarez Hamilton. Can I speak on item 7 and then all available items?
Sure, you'll get 2 minutes for the items. Please begin.
Bless you. Thank you very much. I would like to speak on file 210878. The vaccine requirement ordinance is attempting to violate our freedoms protected under the U.S. Constitution, our California Constitution, the California Patient Bill of Rights, the UNRU Act, and the Civil Rights Act of 1964. I have noticed our City Council is determined to cite 1903 smallpox vaccine laws. I believe these vaccine laws are antiques and fossils of the darkest shadows of this country. These century-old laws were unconstitutional, and I believe they caused great harm to this society. These laws were precursors to the 1913 eugenics movement and were an inspiration to the laws set by Nazis during the prosecution of people in the Holocaust. Please slam down this vaccine requirement ordinance. We, the people, are opposed. Now, about everything on the agenda items, I think it's important to know our California Constitution protects people's medical freedom and the right to equal protection under the law. The California Patient Bill of Rights protects people's right to refuse life-saving treatment, refuse medical research, and refuse experimentation. The UNRU Act outlaws all arbitrary discrimination from the public and private organizations, whether unintentional or intentional. The Civil Rights Act of 1964 prohibits any federal funded organization from participating in the discrimination of personal characteristics. Slam down this vaccine requirement ordinance. We beg you, we the people are opposed. Bless you, thank you for my time.
Thank you, Speaker.
Next speaker.
Please
Hello.
state your name and the items you'd like to speak on.
Hi, my name is Natasha Castro, and I would like to speak on item number 7.
Sure, you have a minute. Please begin.
Okay, thank you. Hi, I'm speaking on behalf of the Los Angeles Alliance for a New Economy. I want to express our support for your leadership regarding item number 7. As you know, grocery and retail workers were deemed essential workers during this COVID-19 pandemic, and unfortunately, they continue to experience some of the highest rates of infection. On top of this, they have been subject to anti-maskers and anti-vaxxers, lack of on-site testing and social distancing, as well as poor contact tracing, low staffing, and increased violence and theft. Therefore, we strongly recommend that this ordinance include a well-trained, full-time health and safety officer for each retail establishment. It is impossible for retail workers to maintain the store inside and enforce the vaccine requirement outside. Too often, companies push the burden of enforcement onto their employees who are already understaffed. We strongly encourage the Los Angeles City Council to do everything to make this policy successful through strong enforcement. Retail companies must be part of the solution.
Thank you, Speaker.
Next speaker.
Please state your name and the items you'd like to speak on.
Yes, my name is Julie Levine, and I'd also like to speak to item 7, file 21-0878.
Sure, please begin. You
I
have a
just
minute.
want to say, as a lifelong Democrat, I have always believed that the Democratic Party was about unity and bringing communities together. This mandate will do just the opposite. It will deepen the divide. It will deepen the demonization of people that, for reasons, including health reasons, like in my case, would choose not to get this vaccine. People who are using all of the preventive protocols, people who use alternative medicine, people who don't trust big pharma, low-income communities. I've been part of a foundation initiative for many years to make sure that there was fresh food provided to South and Central Los Angeles. This will do just the opposite, being that the higher unvaccinated rates. Now, you can push a lot of things, but honestly, forcing people to do things against their will that are against their understanding of what's best for their own healthcare needs and even for their community is very damaging, and I really hope that you're going to reconsider this. And I finally want to say that there is
Thank you, Speaker.
Please state your name and the items you'd like to speak on.
Hello, my name is Steve, and I'd like to speak on item 7. I believe it was 2078. Sorry, I apologize.
That's
for
all
that.
right. You have a minute.
But
Just begin.
Okay. I am very much pro-vaccine. I have been my entire life. That is how I was raised. But I do not think that it is a right thing to be doing in this day and age to categorize people based on vaccination or not. I believe it is everybody's personal civil liberty to not have any of their medical history provided to anybody for any reason than for medical reasons to their doctor. I appreciate your time. I hope you vote this down. I am very much opposed to it, but I am very much pro-community and pro-health.
Thank you, Speaker.
Please state your name and the items you'd like to speak on.
My name is Kathleen Gildred, and I want to speak on item 7 and on general comments.
So there is no general public comment. This is a special
Okay.
meeting, but we'll give you a minute for item 7. So please begin.
Okay, thank you. I strongly oppose the COVID-19 vaccination requirement ordinance. The CDC recently announced that the vaccinated transmit the virus just as easily as the vaccinated. A growing percentage of people in the Los Angeles area who are vaccinated are getting the Delta variant. You might not know, because this was just announced, that it won't be until 2026 that trials to evaluate the safety and efficacy for the newly approved product for 16 years and older, and the observation of documentation for myocarditis and heart problems and for pregnant women won't be complete. So we are living with an unknown thing. The vaccination won't stop the rise of new variants, and in fact could push the evolution of strains that evade their protection. Contrary to Pfizer's assumptions, the mRNA does not stay in the muscles, but from their own literature, it goes circulates through the blood and is a reason for blood clots, bleeding, and myocardia.
Thank you, Speaker.
Next speaker.
Please state your name and the items you'd like to speak on.
Yes, this is Mr. Goat Puppet. All items and general public comment.
There is no general public comment. You have 2 minutes for the items. Please stay on topic and please begin.
I told you there was no general public comment. Come here. Ow! Told you about that. Now go ahead. All right, I'm sorry. Ow, hurt my fucking
Okay, please
nose,
stay on
woman.
topic, speaker.
All right, I'm sorry. Go ahead. Talk. All right, yes. Okay, so we have the vaccines. And you humans, now you've been reduced to cows. And you're going to take your shots. And we animals are laughing because you've been stuffing all kinds of hormones and shit up our asses for many, many decades. So you can make us fatter and sell us for bigger steaks and things like that. So, yes, if you take the vaccine, you will be submitting to the mark of the beast. And that's good for all of you. Gil took the vaccine. Submit to the devil. Take your vaccine. Not going to take your vaccine? Well, then you have a chance to get on your knees right now and declare your Savior as Jesus Christ while you still can. Because Nuri Martinez is the Antichrist.
All right, you're off topic
No
yet
shit.
again, speaker, so we're going to cut you
Martinez
off.
is
Thank
the
you,
anti-
speaker. Let's move on to the next speaker.
Please state your name and the items you'd like to speak on.
Yes, my name is Lisa Kastner, and I'm interested in speaking on item 7. Do I need to describe that item?
No, please just begin. You have a minute.
Okay, thank you. I'm concerned because I'm opposed to this this bill. The data coming out, as opposed to the narrative that we're being given in the news, the data that's coming out of Israel, where 80% of the adults are vaccinated, is that 50% of those with COVID now have been vaccinated. In fact, 85 to 90% of COVID-related hospitalizations are among those fully vaccinated, and the fully vaccinated also account for 95% of severely ill COVID-19 patients. There's a new article that's being published in the respected journal, The Lancet. It was published August 10th, found that vaccinated individuals carry 251 times the load of COVID-19 viruses in their nostrils compared to the unvaccinated.
Thank you. Thank you, speaker.
Please state your name and the items you'd like to speak on.
Hi, my name is Justin, and I'd like to speak on item number 7 and all available topics, please.
So if you want to speak on item 7, that's 1 minute. Do you want to speak on the other items as well?
Yes, sir.
Then you have 2 minutes. Please begin.
Thank you. So I'm listening to everybody calling in. I appreciate the woman who called in who was saying that, she represents the frontline workers and the, people who are working minimum wage jobs. I live with some of these people. I live with these people who are doing these jobs, and they're thankless jobs, and they are, but they don't want to get vaccinated. A lot of people don't want to get it. There are a lot of people who don't believe that they need it for various reasons. I think that it's wrong to mandate this because I work with all kinds of people of color, everything. And a lot of these people are speaking out and terrified right now. Terrified. Why would you insist on pushing something that's causing people fear, discomfort, allowing them to not get sleep at night, which is probably going to make people worse, probably make people sicker. I think I'm over this. I think that if you want to cause a religious revival in Los Angeles because of this, this is the way to go. I think that as a lifelong Democrat and somebody who has been vaccinated before, I think that all of this stuff is getting bad. Call me somebody.
Do you want to move on to the other items, speaker? You want to speak to the other items?
I think that I've had enough. Thank you.
All right, thank you, speaker.
Please state your name and the items you'd like to speak on.
My name is Drew for item number 7.
Sure, you have a minute. Please begin.
I'd like to express emphatic support of this. This is what we need. You're going to hear a lot of arguments already of like medical freedom. Those are ridiculous arguments. This is called vaccination community records, which we've all been doing for years. You have to have certain vaccines to go to college. You have to have certain vaccines to join the military. Your dogs need to be vaccinated where they can hang out with other dogs. We need to do this. My only complaint would be, I think it needs to be for the fully vaccinated, not just one dose. Businesses are open to this idea, and it's going to save lives. The idea that it's taking away something that this country's been doing for 100 years is ridiculous and just, frankly, doesn't hold any water. The fact that they can spread the Delta variant, yeah, they can, and the numbers show it is so much less likely. Please support an LA citywide vaccine mandate. And it's not a mandate for people to have to get the vaccine. It's saying if you want to go to a bar or a public, you're going to be less likely to get your neighbors and...
Thank you, Speaker. Speaker, can you unmute the person we're trying to prompt?
Caller ending in 0533, please unmute. Press star 6.
Okay, so if you don't unmute...
Okay, thank you.
Please state your name and the items you'd like to speak on.
My name is Joy, and I'm calling on item 7.
Sure, you have a minute.
And listening to the previous caller, yes. You know, it would be one thing if these actually weren't. The absolute risk reduction for both vaccines is between 0.7 and 1.1%, which is no greater risk reduction than without a vaccine. As far as safety, the black box warning now on the inserts and on the fact sheet is there's a very high risk of myocarditis and pericarditis, which is heart inflammation. Are you willing to mandate this and have this on your conscience that people could develop these things that are healthy? Micro blood clots are being found in high rates when D-dimer tests are being performed. Dr. Hoff of Canada states 62% of his patients now have microclots. This is a ticking time bomb. Also, in a big mass event, Barnstable, Massachusetts showed 2/3 of cases were from vaccinated. So I don't see that this is working. Michelle Lewinsky has also stated this. I highly hope that you will vote no on this so that we can actually come up with...
Thank you, Speaker.
Please state your name and the items you'd like to speak on.
Hello, my name is Ruby Rivera. I'll be speaking on items 3, 4, and 5.
You have 2 minutes. Please begin.
Hello, my name is Ruby Rivera. I'm the Director of Organizing with Inner City Struggle. I'm just calling in to support a debt-free recovery to keep LA housed. We call on City Council to process existing ERAP applications quickly and disperse funds now. Tenants have been waiting for weeks, unsure of when they will receive relief. The longer this is delayed, the more vulnerable they are to harassment and eviction. In order to receive protections under new state ordinances, tenants need to get into the system ASAP so they can access state eviction protections. HSID has reported that the city does not have enough funds to cover the rent that is owed, and the city should continue to pressure the state to reallocate money to ensure that all eligible tenants get the full debt relief they were promised. We also need to keep protecting tenants from eviction, or else rent relief will just end up being a massive landlord bailout. So an equitable recovery depends on tenants being debt-free. So we would like to support recommendations made in HSID's report, calling on the City Council to join the state program so that tenants can begin to continue to apply to that program and receive protections as well as allocation of rental assistance. Thank you.
Thank you, Speaker.
Please state your name and the items you'd like to speak on.
Yes, my name is Sylvia Rostami. I'd like to speak on number 7.
Sure, you have a minute. Please begin.
Thank you. Even CDC Director Walensky has said that the vaccines, quote, cannot prevent transmission. In fact, they were never designed to prevent it. So if vaxxed and unvaxxed people can equally spread COVID in indoor spaces, what possible reason can you have for excluding unvaxxed people from indoor places? Council members, you must be clear. You are contemplating voting to implement an apartheid on our city without even having a shred of scientific reason for doing so. This is the most heinous tyranny that you are looking to impose, the least devastating result of which will be to put the final nail in the coffins of many thousands of already devastated LA businesses. France, Germany, Australia, etc. have had unending rioting and unrest because of similar oppressive mandates. How can you inflict this on our great city? Don't do this, please, I beg of you.
Thank you, Speaker.
Please state your name and the items you'd like to speak on.
My name is Beverly Barris,
Hi,
and I'd like to speak.
which item would you
Hello?
like to speak on? Yes, what item would you like to speak on?
Item 7.
Sure, you have a minute. Please
I-
go ahead.
I couldn't agree more with the last speaker. We already have laws in place. California Health and Safety Code 24171 and 24172J gives the rights of individuals to determine what is done to their own bodies. We have the Nuremberg Code and the Declaration of Helsinki, which absolutely prohibits any form of coercion to make individuals participate in a medical experiment. We have the Unrun Civil Rights Act and other California protective laws. The people will assert their rights and litigate. So what's happening with these laws? They're already in place. So I really don't understand how we can even be getting to this place right now, which will devastate people, and there will be an uprising, and there will be people in the streets. I mean, we don't need riots here. We don't need violence here. We need peace. We need to come together in love and peace and let each other, look, if people want to take the vaccine, let them, but at least minimum, let them.
Okay, thank you. And members, that concludes public comment for today's meeting. I'd like to take items 1, 4, 6, 8, and 9 on consent unless there's any questions or comments on these items. Okay, seeing
So-
none, those items are approved without objection. So let's move on to item number 2.
Councilmember, we did have an amendment for item number 8.
Oh, you did mention that to me. I apologize. Do you want to go ahead and read that amendment?
Yes, thank you. Please amend the CAO report by deleting recommendations 2C and 2D and adopt the CAO report as amended. Thank
Okay,
you.
without objection, that will be the order. Thank you. And we're going to move on to item number 2. Members, I have 2 recommendations on this item, so if you just bear with me, I'd like to read them into the record. I'd like to approve recommendation 1 and 2 in the CLA's report and amend recommendation 3 to instruct EWDD to create a website called womenatworkla.com that would serve as a guideline to private sector businesses looking to adopt family-friendly policies, including a business toolkit and other resources for businesses. The website should be promoted throughout the city's business source center, and the city should encourage local businesses to adopt these policies. I also would like to add to recommendation 4 to instruct EWDD to create an Office of Workplace Equity and Diversity, and to work with the CAO's office and the CLA's, to work with the CAO and the CLA to report back on positions and funding needed to launch the office. The city's personnel department already has an Office of Workplace Equity to deal with equity and diversity issues within the city family. During this pandemic, I've launched programs to help promote equity and diversity in the private sector, and that work should just continue even after the pandemic. So if I can get a second to that, we can move on.
Second.
Second by Mr. O'Farrell. So without objection, that will be the order. And we're going to move on to item number 3, and we have our guest here. Hi, Ann Swoles, the general manager of our housing department, is with us in the building. So, sergeants, can you help? Where are our sergeants? Miss Swoles, just make sure she's her mic is working. Oh, you got it, Ann. Never mind. you could figure it out. And Anna Ortega is with us as well? Oh, virtually, okay. So Anna, can you hear us? Anna and Ann, I love it. English and
Yes,
Spanish.
I can hear you.
Okay, Anna, thank you so much. So why don't we go ahead and have, which one of you would like to do the housing update on this item regarding the Emergency Renters Subsidy Program?
So Anna's going to begin and read the good afternoon. Ann Sewell, General Manager, Los Angeles Housing Department. Anna is going to begin talking about where we are and the recommendations in this report, and then I'll talk about the proposed change for the committee's review.
Okay, so Ms. Ortega, go ahead and you can start the presentation and then we can go into questions. Go ahead.
Thank you very much. Good afternoon, Madam President and council persons. Today, our report will update you on the status of the ERAP program, provide certain fiscal recommendations to take us through the end of this phase of the program, and present the Housing Department's recommendations for going forward. As you probably know, the Emergency Renters Assistance Program launched in March of this year, March 15th. At that time, we opened it up to applicants from the 2020 effort that successfully concluded on December 30th and provided about $100 million of rental assistance to approximately 50,000 LA households. Following that, additional funding became available through the federal and state government, totaling $259.4 million, of which $235.5 million is allocated for rental assistance, and about $23.9 million is allocated in the admin reserve. The program, as I mentioned, launched on March 15th for the waitlisted candidates from the 2020 effort, and then opened up again on March 30th for new applications. It ran for about 7 weeks until April 30th, and following the conclusion of the application period, within 3 weeks or so, we made the first payments on May 24th, 2021. At the end of June 29th, the state made substantial changes to the rules for the program. The initial program was launched under SB 91 that required an 80% payment to landlords and required landlords to forgive 20% of the past due rent. If the landlord did not accept the payment, then the program would pay tenants only 25% of the past due rent. That was the way the program was structured and built and created initially. Then, as I mentioned, at the end of June, the rules were radically changed, essentially making them much better for both landlords and tenants and allowing 100% payment, whether it was paid to the landlord or paid to the tenant. So no longer was there any 80% and 20% forgiveness, and there was no longer any 25% payment to tenants. But it did require radical changes in the notifications and systems and everything else that the program had been doing up until then. We've been proceeding with processing applications in these months. At this time, we have a total, counting Family Source Center staff, contractors, and LAHD staff, we have almost 300 people working on this program. As of today, we are completely expended in available funds. We have approved almost 17,000 tenants that will need every penny of the $235.5 million. Our applications are substantially exceed the 17,000 that we can help with this program. And additionally, with the changes in state legislation under AB 832, there's a huge need to reopen applications. So our recommendations provide a path forward to provide additional funding as we go forward. But what we're doing today is asking for approval to fully allocate the administrative reserve and especially to augment our contract with HRC to allow them to hire more processors so that we can expeditiously finish funding and approving the applications for the remaining number of the applicants in that pool of 17,000. There's also a technical amendment to the controller instructions, which is to the 8th item of the controller instructions, which mistakenly reference account 43T299 in the amount of $423,979.54. The amount is correct. However, the account that should be referenced in that instruction is account 43V299. So with that technical amendment, everything else there should help us have the resources necessary to continue to process and timely assist the pending pool of landlords and tenants. As of today, we have, as I said, allocated all of the funding. $60 million has been paid or is in process, and updates are shown they're updated every week at the HCIDLA website at hcidla2.lacity.org/ERAP, where anyone can see and sort by council district, by census tract, by zip code, just what the process is and where applicants are in the current pool. So that is updated all the time, and it's a valuable trove of information for anyone who's interested in the program. So with that summarizes the status up till now of ERAP 1, and I will turn it over to our general manager.
Thank you, Madam President. So, as Anna said, in February we received $259 million, of which $235.5 was allocated for direct rental assistance under what we call Emergency Rental Assistance Program 1. As part of the American Rescue Plan, then Congress and the President allocated what to us would be another $260.2 million, that some of which came directly to the city from the Treasury, the bulk of which, as they've been doing, went to the state to be allocated to the city. When we came to you in late February, we had a choice, as we have right now, to decide to administer the program ourselves or to partner with the state to administer the program through them. And at the time, with the experience of the $100 million program under our belt and the state really being new to it, it seemed safer and smarter that we would start the program ourselves. One of the challenges then, it meant that we knew our budget, we knew we had to live within our budget, we had to prioritize the lowest income tenants to address our budget, and fundamentally the state has an almost unlimited budget. They have $5 billion, of which a fair amount is unallocated, to be allocated among the cities as need be, and then of course nationally there's a lot of money that some states are not using as much. So we are recommending to you now that in this round of the Emergency Rental Assistance Program 2, we contract with the state using option A under their formula, where we would give them the money that the Treasury had allocated to us, and they would agree to accept all of the tenants that had applied that we can't serve right now, plus new tenants who who've never applied, as well as the law allows people to apply for up to 18 months of assistance, so some of the tenants that applied and were already paid could apply for additional months if they still need it. So it will allow residents of Los Angeles to get into the queue and be funded without having to wait to seek reallocation to our budget. The state can continuously reallocate. We've negotiated very carefully to be able to make sure that we will continue to have the kind of support that we need to provide navigation services to our residents and work with the eviction defense program. So we're confident that this will work for Angelenos, and it will really help to have our people be included in the umbrella of the governor's promise that this program will serve, completely serve the rent needs of all Californians. There was a question that was asked about the moratoriums and how they are different between the state's rent moratorium and our rent moratorium, and we talked about this a little bit in the report, but I wanted to highlight it. Part of AB 832, which set forth the changes that Ms. Ortega mentioned, was that it created a requirement that if a tenant could demonstrate that they had submitted a complete application to any of the emergency rent programs, the courts were not allowed to issue a summons, which is the beginning of an unlawful detainer process. Our moratorium, which will continue for a year beyond the expiration of our emergency declaration, can be used in court as an affirmative defense against eviction, but that happens later. So the thing about the states is that they will prevent people from being able to get that summons in the first place. So we are available for any questions, and our recommendation is set forth in the report that we go ahead and execute an agreement with the state to administer the program.
So before I turn it to Mr. O'Farrell, because I know he's got a series of questions, really quickly, when will the department finish processing all the checks and applications for this current round?
So as Anna mentioned, we now have approved all of the tenants that can, the 17,000 tenants that can be funded under the current round. And that means that we now shift to getting the information from the landlords. How much rent do they think is owed? Sometimes those two numbers don't directly line up. And part of what we're trying to do is get the landlord to agree that they've been fully paid. So we ask the landlord for their payment information, proof that they own the building, and then the confirmation of the rent that's owed. And so we're starting on that process. Probably it'll take another 6 weeks to get all the way through those. We've paid almost 4,000 of the tenants, so that leaves 13,000. So, and we're paying about 2,000 a week, so it'll probably take about 6 weeks to do that.
And then before I turn it over to Mr. O'Farrell, I also heard that other jurisdictions are not spending down their dollars. Is there a way or a process in which we can reappropriate some of those unspent dollars to Los Angeles?
That's exactly what we are doing with this move to the state, is that they have only appropriated directly into people's accounts a portion of the money and kept the rest of it as an unallocated balance, and they can just move. AB 832 allows them, gives them the authority to move money to cover all the applicants as they come in.
I see. Mr. O'Farrell?
Excuse me, Madam Chair, I'm so sorry to interrupt, but I would like to state for the record, it's been brought to my attention that at 2:01, Mr. Cedillo joined us.
Oh, you scared me. You jumped
sorry.
up. Like, what happened?
Just verify.
Okay, Mr. Cedillo, were you with us, sir? Just want to get a quick verbal.
Present.
There we are.
Thank you.
Thank you so much.
Thank you, Madam Chair.
Thank you, Madam Clerk. Mr. O'Farrell.
Thank you, Madam Chair, and thank you, Ms. Ortega, and thank you, Ms. Sewell, for explaining the amazing amount of work that has been set up, or the amazing amount of professionalism and process capabilities that you have stood up because of the city's action with our two phases of rent subsidies that we've enacted over the last year plus through the first $103 million fund, and then the second $235 million fund. To think that there are 300 people processing these payments is remarkable, and so I just want to thank HCID for your work on that. Nothing more important. There's so much anxiety, of course, that renters are feeling, and that goes without saying. What I would like to do is just ask a series of questions, mainly to just get clarification for anyone who might be listening, because it's a very complex issue, and where you have a meeting of funding that has been allocated by the city, and then funding allocated by the state through AB 832. So what I want to convey to Los Angeles renters is that compared to the rest of the state's back rent subsidy program, renters in Los Angeles have complete equity in being able to access the back rent program from the state. And so that my questions will relate to that. So Let me just start by saying the back rent subsidy program from the state, as we all know, was introduced with great fanfare after the governor signed the bill a few months back, that this funding would help renters across the state of California pay 100% of their back rent owed, as long as it was related to the COVID-19 pandemic. I'd like the department to be able to state explicitly whether or not you feel such a claim is accurate. And that regardless, if this committee moves forward with the recommendations in today's report, that the City of LA renters will not be at a disadvantage compared to the rest of the state's renters. In other words, every household in Los Angeles and across the state has equal access to this funding. And that this is not a first come, first served allocation. What I don't want to see is when LA renters apply for this, that they're toward the back of the line, since the portal has been open across the state for several weeks now. So what is your response to that?
I could address that. So part of our agreement with the state is that we will give them a list of all of the 52,000 applicants that we hold that we have not been able to get to with our funding. And those people, they're going to have what they call a strike team that's going to process that. They're going to give priority. I think realistically, we are the only locality in the whole state that has been as oversubscribed as we are. Many localities aren't even remotely fully subscribed, and there are only a few that are approaching being fully subscribed. So our folks are going to be a huge part of the overall total going forward and processing what we already have. So yes, to answer your question directly, I'm confident that this will actually improve access to the funds for residents of the City of Los Angeles.
Great, thank you. So, we all know that the pandemic exposed the magnitudes of structural societal inequities, especially in the service sector. Those jobs were the most affected by the pandemic, so it makes it even more challenging for residents to maintain their housing. And the unfortunate truth is that we know that city residents existing at the low end of our economy already, who've been affected the most during the pandemic, are overrepresented by communities of color. And of course, they'll once again be the most vulnerable to being evicted once, this era comes to a close, which I think they have exponentially increased likelihood of experiencing homelessness once evicted. So I want to make sure that Angelenos can address this or can access this fund. So I want to just say that we're eager to ensure that this other infusion of subsidies, this time from the state. Now, we've identified, I think you said $260.2 million for the city from this state fund. Is that right? Is that the need that you have identified, or is that the funding that the state has made available to the City of Los Angeles for this back rent subsidy?
That is the City of Los Angeles's formulaic allocation from, not the state, but the Treasury, when they took the whole pool. So we received some of it, a little bit of it directly, under $100 million, and the rest went to the state to be allocated to us as we spend through. So in this example, we are sending our money to the state, and they will administer the whole program. We know we have need that exceeds that, and so what's exciting to us about this is they are not going to stop when they get to the end of that $260 million. They are going to keep processing every application that they get.
Okay, and so according to the report that we're looking at today, the total potential of just the city funding, ERAP 1 and 2, so combined with the state funding, is nearly $500 million in direct rental assistance funding, right? But I understand from the report that the projected need for rental assistance in Los Angeles is estimated at $950 million based on current applications. Is that accurate, or am I imagining?
That is our estimate. We received by the end of April, the applicants told us that they needed $530 million. And of course, if they continued to not be able to work due to COVID, their rental arrears grew. And then we had other applicants that didn't even apply before the end of April. So we took what we had received and we projected it out both in terms of time and in terms of applicants. And that's how we arrived at that number.
Okay, so recommendation C asks to authorize an agreement with the California Department of Housing and Community Development to administer the $950 million from this state program. And you just mentioned there is, there's a greater need than perhaps what the report states is the city's allocation. Do you think there's a need to actually accept a funding ceiling? Could we move that?
They do ask for each locality to put a number, basically to authorize them to administer up to some amount. So we couldn't just say, infinite, but it could be larger than that if we wish to.
I think we should, Madam Chair, I think we should consider raising the ceiling a little bit so we have a little bit of a buffer so that it doesn't have to come back and we have to go through some sort of additional administrative process just for the city renters to obtain more funding should the need be there. I mean, look what the Delta variant has just done. I think probably more people had to go on leave because of that alone. There's still some unknowns. So if the need has already been stated and articulated as it now exists, that need could grow. So I would like, Madam Chair, that to either, just to increase that ceiling with a bit of a buffer, maybe $1.2 billion or something instead of the $950 million. I mean, so just something I'm thinking of off the top of my head. The report notes that more than 70,000 tenant applications and 40,000 landlord applications were received for the city program. And we're sure that no duplicates have been received for the same rental units. Do you feel that the department has sifted through any of those possible duplications?
We did. We received 110,000 applications to begin with, and we sifted duplicates where landlords and tenants had both applied, and many, many people who did not actually live in the city of LA. And it became the 77,000.
Okay. All right. Madam, Madam Chair, I'll just breeze through the rest of these questions because I know Mr. Price and Mr. Cedillo have questions as well. So will applicants not be chosen that haven't been chosen for the city rent subsidy be given any priority for state funding to achieve that 100% back rent payment?
So yes, if you are one of the delta between the 17,000 and the 77,000 that we received your application, we are giving your name, your address, and your landlord's name over to the state, and they will put them in the priority list and give them access to that strike team of people that they're setting up to process those really quickly.
Okay. And so if a applicant received a city subsidy, and the city subsidies by and large for many, many applicants, probably tens of thousands of them, did not cover all of the back rent, could they still apply for the state funding to fill that gap?
Yes, so if a tenant applied for back rent, say through April, and we gave them the check, gave their landlord the check, and then they subsequently had more back rent, they weren't able to pay rent May, June, the total is 18 months under the law that they could be paid. So they could apply for the extra months to the state as well, even though we already funded them.
And thank you. And here's an important accounting question. Do you feel confident that HCID will have real-time data from the California Department of Housing and Community Development?
We do. Our colleagues in the LA County Development Agency have, the county chose to go with option A in the first round, and they've been very satisfied. We've been talking to them constantly about their access to real-time data, and we feel very comfortable with what we'll be able to get from them.
Great. And we probably did a lot of, inadvertent beta testing on multilingual applications is multilingual residents where English isn't the first language. Do we feel confident that language won't be a barrier to accessing these funds in the state as they are in the city?
Yes, as you said, we've been really careful to make sure that applications and instructions and assistance is available in multiple languages. And we've discussed that with the state, and they have the same access in multiple languages.
And just to say for the record, neither the city funding rent subsidy program was dependent on immigration status, and the state funding is the same. Is that right? Regardless of immigration status, you can qualify for these subsidies.
It is, regardless of immigration status.
Fantastic. And then just two more quick questions. How soon will we be able to update the website information accordingly so that all the systems are merged adequately?
So if the committee recommends, this set of recommendations to the council, it would go to council tomorrow, I believe. And we would then be working, we need to get emails out to every one of those 77,000 people, since they're going to be hearing about it, reading about it, telling them which group they're in. You've already gotten paid, but you could go apply for more. You're about to get paid, stick with it for a couple more weeks, because then after we paid you, you could then go apply for more if you needed to, and you should go apply now. So we're working on those emails right now, and those would go out, literally Thursday morning. And then we've discussed with the state, flipping the switch so that Angelinos can apply under the Housing is Key website. Hopefully no later than September 1st. Our goal is to do it on Monday if we can. It's really just
Terrific.
a question of getting that together.
Thank you. What I heard for anyone listening is that Los Angeles renters have a seat at the table equal to everyone else who applies for this state back rent subsidy. That HCID believes that transitioning this over to the state, because the relationship and all the systems are in place for a collaboration to get money out the door as promptly as possible, is in order. And so this report has, and your answers have given me a lot of confidence. I want to just reassure Los Angeles renters and landlords who will also be applying that we are moving in a great direction to continue our priority that we set forth at the very beginning of the pandemic to make sure that people stay housed in the city of Los Angeles. And I want to thank you, and I want to thank the governor's office. I know we're working closely with our state partners as well, just to ensure this benefit for Los Angeles residents as well. So with that, Madam Chair and Ms. Sewell and Ms. Ortega, I thank you very much. And I support taking this direction that you're suggesting.
Mr. Price?
Thank you, Madam President. I too want to thank the department for the presentation. I think it's very good, certainly very timely. You mentioned, Ms. Ortega, that emails are going to be going out to notify those who have received in the past and potential recipients that there's a new process now. I'm not so sure that, majority of my constituents will be running with their emails to get this information. So how else are we getting the word out? What role are the family source centers, for example, going to play in this process? And will it be seamless? In other words, are we still going to be asking folks to apply to the city website and then it goes to the state, or it's a whole different application process now? How can we smooth things out and make things more accessible and easier to use?
That's a really great question, and I'll jump in, but Anna wants to add something, council members. So we have been communicating with all applicants by email, but also on our website, people can go on and access exactly they can see where their status is. So right now, it either says that they were paid or that they are pending. And so for those that we're going to, continue to work on and pay them, it'll say, completed application, something about, payment pending, and the tenants that we're referring to the state's program will have a notation that they should go apply to the Housing is Key website. We did discuss with the state in great length about the feasibility of just porting applications over. One of the things that took longer with us is we allowed people to submit incomplete applications, because we know that a lot of people needed help at our family source centers or help from our staff. So you could just submit without uploading any documents and things like that, and then we worked with you. The state really requires that people come in and fill out, get an account and fill out the application, so there's not a one-for-one comparison to the materials that we have and that they need. So we are really informing the tenants that they will need to apply through the state's program, but that we are giving their name so that they have priority to the state.
Can they come into the Family Source Center?
They can still, we're
fill that out?
Yes. And we're also working, by next week, we hope to be able to announce that the state is expanding its group of navigators that, people can come into the Family Source Center, but we also want people that will go out through trusted community organizations to work with, like the groups that are working with our eviction defense program that the council approved, to go out and work with them on those applications.
How many more applications do we think are out there? Individuals who haven't applied now will be applying. How many more do we hope to capture here in the city?
So we've discouraged people who were earning more than 51% or 50% of median income up to, you could earn as much as 80%. We basically told everybody in the first, materials that they were not a very high priority. And so we only got a smattering of applications from that group, and we expect that there will be more. And then people who maybe thought that they didn't need it, but then subsequently, had a job loss and they are eligible due to COVID will also come in. So we really couldn't predict exactly how many more people in the very low income groups, but we are pretty sure there's a lot of pent-up demand in the 50 to 80% group, as well as more people in the lower income groups.
So is there a formula by which the state's going to distribute these funds, or just as needed or as required, or have they allocated monies for certain areas, or we're just encouraging neighbors to sign up as quickly as possible?
Just encouraging people to sign up as soon as possible and processing everybody. Their commitment is to, as soon as you have a completed application, they are trying to get you processed within 5 or 6 weeks. So, it doesn't matter how long, obviously our people are going to get priority, but the people that have been waiting, but it doesn't matter if you are earning 30% of median, 40%, whatever, they're going to process you at the same time, as fast as they can.
And this is still a joint application process between the tenant and the landlord, or can the landlord apply, or can the tenant apply? How are they both
a little
required?
bit of a misnomer, because the legislation in Congress and then it's at the state talked about how landlords could apply, and they can, but the certifications as to the reason why people lost their jobs need to be made by the tenants. That the landlord can't really certify that the tenant isn't able to pay the rent due to COVID. So we do have to have, there's really no such thing as an only landlord application. It has to be a cooperative venture between the two.
And again, they can come to the Family Source Center to get that technical assistance to apply.
Yeah, so people can go to the Family Source Centers right now, or have been able to upload documents and get help, get an appointment to talk to them about completing their application. And now we're pivoting to have the Family Source Centers have the information about how you do a complete application for the state.
Well, this is just extremely important. Just last week I met with the group, and that was their concern. Why is we say that there's money available, but the portal is closed. So this certainly addresses that. But we got to get the word out and really encourage folks to do it. And so I just hope that we are really taking advantage of the network of not just Family Source Centers, but community-based organizations that can help get this word out and help actually process these requests so that we can make sure that that LA residents get the highest priority possible in terms of receiving these benefits.
Absolutely. We agree.
Thank you, Madam Chair. I support the proposal by Councilman Farrow. I think we should increase that limit, go for as much as we can, and create an atmosphere again that's going to make these resources available to our residents.
No, I don't disagree, but I would recommend that the department come back to this committee and advise if we need to increase that ceiling and by how much. I want actual numbers. Okay, Mr. Price, thank you. Mr. Cedillo?
Yes, thank you, Madam President. This is a very asked question in my district. I think the first question I want to know is, how much is in the bank? In other words, how much money has gotten out versus how much is still being processed?
I'm going to turn to Ana Ortega to explain how much we've dispersed right now and then how much is in process.
So as of today, we have processed or paid out actually $60 million. We've approved tenants up to for the whole amount for $235 million. So that means about $175 million worth. We're in the state where we're still getting the landlord processed. And so that is why we're asking for an increase in the HRC contract so that they can add processors to get those remaining approvals done in the next few weeks. So there's about 12,000 tenant landlord applications that still need to go through that second stage review with the landlord and getting the payment information.
Okay. Just on that point, in terms of processing, let me suggest that some of this money needs to be invested in the process. We had an experience when we did driver licenses for 1.7 million people, and the governor wisely invested, I believe it was $40 million, to create these service centers, to hire people, and to create the IT infrastructure so that that process could go on and meet the need. And so I don't think these are things that can be done within the normal framework and the normal infrastructure that exists for any department, whether it's city, state, or county. So one recommendation would be that there be a larger investment on the admin side, on the operations, because people who are waiting, it's play off the, justice delayed is justice denied. There's a rent delayed is rent denied, and it just keeps this ongoing stress on tenants and small landlords throughout the city. So that's one. I'm interested to know I think one of the things in this discussion for us in terms of creating strategies is to assess what is our overall need. And so, what is it that we need to make sure that all tenants and their landlords have their needs taken care of. Mr. O'Farrell had mentioned something around $950 million. That's a number that we could then do measurements around in terms of how we organize strategies to meet the need of our city.
Sorry,
Well, and if I can just interrupt, one of the instructions today is to basically double our efforts to hire more processes so we can expedite this a lot quicker, correct?
Correct.
Okay.
Thank you.
Yeah.
Any other questions, members? Okay, seeing none, I'm going to go ahead and move that we approve the Housing Department report and as amended by Ana Ortega's technical amendment.
Yes, thank you.
Okay.
There were changes to the controller instructions, and we should get those transmitted to the clerk quickly.
Right. Okay. So without no objections, that will be the order. Let's move on to item number 5. Members, on item number 5, I have a couple of small amendments to this item, but on item number 5, I'd like to strike the first 3 bullets of the motion. We already heard from the Housing Department update, and the departments have created a public dashboard that is updated regularly. So I don't think we need to waste more staff time or resources when that information is already publicly available. And lastly, we don't need another report back on reopening the applications. We're instructing the Housing Department to do that, to reopen the application portal today. So can I get a second on that? Mr.
Second.
O'Farrell, thank you. So there are no other questions on this item. I'm going to go ahead and move without objection that this item be approved. Let's move on to item number 7. And item number 7, this is a verbal report, members, from the CLA and the city attorney regarding our citywide vaccine mandate. This is just a verbal report. There's no action. that will be-
CLA and
They
CLA.
will-
City attorney.
CLA and the city attorney, I just said that. We're not gonna take any action today on this item. So before we hear from the city attorney's office and the CLA, I just wanna talk about what we should strive to accomplish with this ordinance. And I think the goals need to be, and there are 3 goals. One of them is to limit the transmission of the virus, to make it inconvenient for those who are unvaccinated to access venues and put lives at risk, and 3, to do all we can to protect those who are not eligible for the vaccine, which include kids under 11 years old. So we should evaluate all of our locations with this in mind. And if I can have Mr. Espinosa and Mr. Clay McCarter from the CLA's office. We also have Valerie. Are you there, Valerie, from the city attorney's office? Yes, I see you.
Yes, I'm here. Thank you.
And Ms. Menecian from the city attorney's office as well. Yes, I see you as well. Can you hear us? So we're joined by our city attorneys virtually. So why don't we go ahead and have the CLA's office give a brief overview before we turn it over to the city attorney and ask our members if they have any questions. Go ahead, sir.
Good afternoon, Madam Chair and committee members. Clay McCarter with the Chief Legislative Analyst's Office. I'm joined by my supervisor, Chris Espinosa. We did a survey of the jurisdictions around the nation that currently have a vaccine mandate. We looked at San Francisco, New York, New Orleans, Los Angeles County, who has a mandate for healthcare workers, and the state of California. Looking at San Francisco, New York, and New Orleans, all 3 of these cities require vaccines for indoor food and drink establishments. For example, restaurants, bars, clubs, hotel banquet rooms, and grocery stores with indoor dining. They also require a vaccine mandate for indoor recreation centers, including gyms, yoga studios, dance studios, and indoor pools, to name a few. And they also require a vaccine mandate for indoor entertainment venues, including movie theaters, music venues, bowling alleys, museums, exhibit spaces, stadiums, and convention centers. The state of California recently enacted a vaccine mandate for all attendees of indoor mega events. These are defined as indoor events with crowds greater than 1,000 attendees. Attendees of these events can also submit proof of a COVID-19 negative test to access the event. And we would add that these mega events do not include venues such as shopping malls or museums. Finally, the County of Los Angeles passed a healthcare worker vaccine mandate recently, which covers all employees who provide care to patients, including doctors, nurses, home care workers, etc. So just as we did this analysis, the global takeaway that we have is that there are currently no vaccine requirements for outdoor activities, and all of these vaccine mandates do not apply to children under 12 because they are not eligible to receive the vaccine.
Okay, Valerie, would you like to add anything before I turn it over for questions from the members?
Just that we are hoping to get some additional feedback on decision points in terms of what businesses the council would like to cover, whether the mandate will apply to patrons or patrons and employees. We'll need a start date And we would like instruction on whether the ordinance will require only a first dose or a person to be fully vaccinated.
Okay, thank you. Well, I mean, let me ask you a question in terms of, the council gave instruction to the CLA's office to gather feedback from businesses, stakeholders, and council offices. Have you started to receive any feedback from these businesses and stakeholders? And I want to make sure that the feedback is incorporated in the draft ordinance. So what have
Yes.
you received back from business?
Thank you. Chris Espinosa, Office of the Chief
Can you
Legislative
get closer
Analyst.
to the mic, sir?
Chris Espinosa, Office of the Chief Legislative Analyst. So far, we've received information or letters from the California Retailers Association, Westfield, AEG, NBC Universal, the Hotel Association, and I believe it's LA Tourism. We did have a discussion with LA County Public Health and some private individuals who own clubs and restaurants and bars. The next wave of outreach for our office is to speak to LAUSD Early Education, Child Care Alliance, the Restaurants Association, and museums and theaters.
Far, can you share with us what that feedback has been?
Yes, we've received, these are some of the major concerns, is that the ordinance should not include retail. Retail has not been noted in any of the other jurisdictions that we have in our chart that we provided you. A strong request for consistency and coordination with
Let
LA.
me stop you before you get any further. When you say retail, are these small mom and pop retail? Are we talking about malls? Are we talking about big anchor stores at the mall? What do you mean by the retail feedback that you received? Because there's a difference between a mall atmosphere, a standalone Macy's or Nordstrom, and these sort of smaller retail shops along, for example, Ventura Boulevard.
Yes. Most of the research that we found to date has to do mainly with food, restaurants, spaces where it's very likely that the mask will come off and there'll be some eating and drinking taking place, so the transmission would occur. But smaller locations like a clothing shop, a liquor store, those types of small retail where the county still requires a mask mandate. So it's not retail in which it's not very likely that you would take off your mask indoors.
Sorry, I cut you off. You want to keep going?
We've heard a lot about the need for consistency with LA County due to all the jurisdictional boundaries and changes that are taking place with mask mandates and vaccine mandates. Enforcement issues and who would be enforcing the ordinance and how would citations work. We've heard concerns about enforcement by business staff. So for example, restaurants, and there would be servers who would be requiring proof of vaccination cards and showing of IDs. So there's been concern over that. There's been some concern about outdoor versus indoor venues. And so the importance of like outdoor malls or theme parks or stadiums, that in the outdoor settings, generally there's a mask mandate or mask requirement. However, in indoor venues where transmission can occur, it seems like those are more likely venues that would require. And then we also just heard about workforce challenges, whether there's labor unions at certain business locations, or the fact that there's still slow hiring by businesses. And so there's a trepidation about being able to hire new employees as the economy continues to ramp up, the challenge of hiring. Thank you.
Okay, then if it's okay with everyone, I'd like to then go to members for any questions or feedback. Like I said, we're not going to be voting on anything today. This is just a verbal report, but hopefully members can start inputting and giving further direction. Mr. O'Farrell?
Thank you, Madam President, and thank you, Mr. Espinosa and City Attorney Flores. Just some other food items, food for thought is that in the spring, the efficacy of the first dose of Pfizer and Moderna conveyed and showed that there's over 80% protection from COVID-19 2 weeks after one dose. So that has really stayed with me throughout this conversation in terms of imposing a vaccine mandate. There's literally no protection if you go in the next day, but 2 weeks later, the data, the scientific data showed that there's 80% efficacy after the first dose of the 2-dose vaccine. And then in terms of, I don't think the intent of this was ever to prohibit anyone from accessing essentials, food, medicine, and clothing. And so I understand the whole retail component, but that doesn't mean that we don't, searching for words here, but that we exempt other retail outlets like liquor stores or convenience stores or other. We want to be really, really intentional with how we protect the public. And so I think that's a real factor as well. And then I think it really needs to be, we need to really challenge the thinking in terms of imposing vaccinations for employees outside of our own city employees. I think that might be a bridge too far. Just some of my thoughts. What we want to really do is protect the public at, for the most part, indoor spaces. I will say that I spoke with a museum operator yesterday who fully supports the requirement of a vaccine mandate for museum customers. And this is a major museum here in Los Angeles, and I won't divulge which one. But there is broad support that I have heard from community members, business owners, that if the city of Los Angeles makes this the law of the land, that proof of vaccine is required for indoor spaces for the public, that it makes their lives a little easier in terms of just being able to say to someone who wants to come in that it's the law, it's not necessarily their own one-off policy. I think that's the problem. Inconsistency is that we have one-off policies everywhere. What we want to do is encourage people to understand and appreciate the science and the data and the efficacy of becoming vaccinated so that there's more of an impetus into just getting people vaccinated against the pandemic. And so I just wanted to put those thoughts out there for the sake of conversation. Thank you.
All right, thank you, Mr. O'Farrell. Members, are there any, Mr. Price?
Just a quick comment, Madam Chair. First of all, it's just important that we encourage folks to get vaccinated. I mean, there's no second, it shouldn't be a second thought. We've experienced, I mentioned before, almost 1,000 deaths in my district over the past year or so. It's just been devastating. We pioneered some of the pop-up vaccination sites at our parks, again, trying to make it available and accessible. But we just have to make sure that this is a program that everyone is adhering to. We really don't have much. I know we asked the CLA to check with nonprofit organizations, businesses that are dealing with youth, how to best protect children 12 years and younger, since they are not eligible now for the vaccine. Any thoughts on that, or how we try to balance those concerns?
Yes, sir. So far right now with the LA County requirements, you look at their latest documents having to do with early education. Right now they do not require vaccination, but they do highly recommend double masking, or if children are going to eat, that they eat outdoors. and that indoor spaces be well ventilated. But it does appear that it would be important that employees of childcare facilities, that we are looking into that issue of looking at employees of childcare facilities, that they should likely be vaccinated. We've also seen a number of articles recently having to delve into that, and we will be reaching out directly to organizations to get their feedback.
Well, it's an important segment, you know, of the economy that not just the kids, but their parents, obviously, that we don't want to overlook. And we need to provide some leadership and some guidance because, you know, these one-off kind of arrangements do cause confusion and make people skeptical that there's no uniformity. So I think we owe it to our citizens to do that. Thank you, Madam Chair. That's all I have.
Mr. O'Farrell, do you have another question?
Just a quick tag along to Mr. Price. So I think it's important for the city attorney to come back with a definition of what it means to be eligible in relation to this ordinance. Children underage who don't have access to vaccines yet, those who physically, it would be not recommended to receive a vaccine, religious exemption, et cetera. If the city attorney's office could come back with the definition of the term eligible for the requirement of vaccinations for public indoor spaces. Thank you.
All right. Thank you, Mr. O'Farrell. The last question I had for you, Mr. Espinosa, is have any of the neighboring cities and counties or jurisdictions considering a similar mandate, have they begun their implementation of a similar mandate that you know of, or how far along are they?
The only ones that we've really seen are San Francisco that are in
That's
the
the
state.
only, yeah.
Yes, and the state of California just released an additional vaccine mandate, and that's for large mega events. And so I think, Clay, is that over 1,000?
Yeah, it's for indoor events over 1,000 attendees.
I also think, you know, maybe we need to follow other jurisdictions, and I know New Orleans has something similar, New York, San Francisco. I'm interested in how they're actually enforcing the vaccine mandate once it goes into effect. So just monitor that as well.
Yes.
Okay. All right, seeing no other questions, members, thank you very much for joining us. Seems like that's the last item on our agenda. Is that correct?
Madam Chair,
Oh, Mr. Cedillo, yes.
sorry, I can't find the hand. Just an overall comment in terms of as this gets designed. I think it's important for us to have as many, as Mr. O'Farrell noted this, as much consistency with the state. The challenges that exist for us publicly in terms of laying out the narrative is that we lack uniformity. And those who oppose this will seize upon that to try to undermine our efforts. Obviously, those who support it are willing to do all that's necessary in the interest of public health. But I think one thing that's very important for us as we interface with, we just mentioned venues beyond 1,000. We have so many in Los Angeles, so many activities. As we head into the fall with all our sports teams and all our other venues, I think it's important for us to be as consistent with the state and with the county, and for us to try to find alignment where it serves our interests. That's all. Thank you.
Councilman, I just wanted to make note that, to your point, AEG Live Nation has imposed its own vaccination requirements. LA Opera, Hollywood Pantages, the Staples Center. So there's a number of businesses out there in the city that are now starting to put their own vaccine mandate in place.
Right, so that's why I believe that this kind of coherence, this chorus of, if you will, in terms of public health is important. I appreciate the private sector leadership, but clearly the city and the county and the state should be leading the way and providing that type of support. I heard you say the importance for, in many instances, to kind of temper down the acrimony where businesses, small and large, can simply say, look, it's simply the law. It's what the city says we have to do. It's what the state and the county say we have to do. That coherence and that consistency, I think, will be incredibly helpful as these private sector venues go forward and try to execute these plans.
All right,
Thank you.
Madam Clerk, are there any other items on our agenda?
There's no other business for the committee, Madam Chair.
Okay,
The desk is
members,
clear.
it's been a pleasure. Thank you very much. Our meeting is adjourned.